Hello, today I am going to talk about Trazodone, specifically the use for insomnia. Trazodone is an old antidepressant that came after the advent of tricyclic antidepressants, but before the first SSRI Prozac. Trazodone has an interesting history in the sense that while it is effective for major depressive disorder and also has some efficacy for anxiety, it's almost never used for these reasons. And the reason being, it is such a sedating drug. The dosage needed to affect mood and anxiety is 300 about. Some people might even need 400. And even 50 milligrams is very sedating for a lot of people. So, Trazodone for insomnia. Let's talk about a couple things. So, how does this work? So, I've got pulled up on my computer the binding profiles, also known as Ki, of all of the different chemicals and metabolites that. So pulled up, I have all of the different binding profiles of Trazodone, also known as Ki. A smaller Ki means that it binds with more affinity to the receptors that they are generally blocking. If you need more information about what binding profiles are or how to interpret Ki, I'm going to have a link in the description. So let's look at this. Number one, the very top one that I've highlighted is for the serotonin transporter gene, receptor, I'm sorry. So Trazodone has essentially no affinity towards the serotonin transporter. So this is not an SSRI. This does not work the same way as Prozac or Zoloft. So let's go down to the serotonin receptor subtypes, specifically the 5-HT2 receptors. So if we look at this, 5-HT2A has a very strong affinity, Trazodone does, to this, and also a strong affinity to the metabolite. So Trazodone is broken down, and one of the active metabolites is called MCPP, and it's thought that MCPP has a lot to do with how Trazodone works for people. And as you can see, with some of the serotonin receptors, it becomes even more powerful antagonists of these when you break it down into MCPP. So we see that Trazodone has activity at the 5-HT2A, B, and C receptors mostly. This might have to do with Trazodone's effect on sleep, although I'm not super convinced of that. Now, if we go down to the one that I've highlighted in pink, I hope that you can understand my little key drawing. I'm not that great at drawing, but what it does with the alpha-1 receptor, I think, personally, is the key ingredient to Trazodone. This is probably why it's sedating, and this is probably what causes Trazodone's side effects, which we'll get into in more detail. So the alpha-1 receptor, its Ki is even down to 12. That means that Trazodone, even in small concentrations, is able to bind and block the alpha-1 receptor. This will have effects such as making you feel sedated, reducing anxiety. It's essentially an alpha blocker drug. This is also probably why it causes orthostatic hypotension. This is when you get up and you feel dizzy suddenly. This is a side effect especially concerning for the elderly. And this probably underlies the very rare but dreaded side effect of priapism, which I have a whole video for, and I will link in the description. Another thing I wanted to mention is if you go down to the H1 receptor, this is histamine, the main histamine receptor. You know, the Ki is somewhere between 220 to over 1,000, which suggests that being an antihistamine is probably not really part of its sedating qualities. And I mention this because I've read many articles and over the internet that claim that it might make you tired because of its histamine blockade. I don't believe it. And then the last thing I wanted to show is that if we scroll down to the muscarinic acetylcholine receptors, this has no affinity whatsoever. It's somewhere over 10,000 Ki. What this means is that, and this is great news, Trazodone does not have any anticholinergic effects. This does not bind muscarinic receptors. For those that don't know what this is, blocking acetylcholine receptors can be very sedating. Benadryl, Unisom, or doxylamine succinate, these work through not only histamine, but acetylcholine receptor blockers. And it can be sedating, but it also makes you feel like super whack. Anyone that's taken the NyQuil or Unisom or whatever you want to call it, it's pretty crazy. So also, blocking acetylcholine receptors has been linked to inflammation in the brain, and it's also been linked to the development of Alzheimer's. It also increases risk of delirium in elderly and is bad in dementia. So this is really great news. Okay, so let's go over the main side effects. So dry mouth, dry nose, and getting dizzy when you stand up are the main side effects. Some people also get a headache. These are probably mediated, as I said, through the alpha blockade. And in terms of sexual function, Trazodone is unique in the sense that it doesn't seem to affect sexual function in a negative way like SSRIs or other serotonin booster drugs. This has not been linked to anorgasmia. It hasn't been linked to erectile dysfunction. There's actually at least some small anecdotal evidence that this actually boosts people's sex drive in certain situations. Now, the most feared side effect of Trazodone, of course, is priapism, which is an inappropriately prolonged erection that does not get relieved through ejaculation. This can become a devastating side effect if not treated properly, as it can cause permanent penis damage to your penis. And again, I have a whole video about that. Look in the description. Okay, so normal dose for insomnia and for Trazodone is generally 50 to 100 milligrams, but sometimes it's as low as 25 and sometimes it's as high as 150. As a medical student, I would say 50 to 100 milligrams is what I see most often and what I see work for people. An important couple points about how to take Trazodone, and again, this is not medical advice. Talk to your doctor before doing anything. I'm just going to go over what the literature just suggests on the effects of food and absorption. So, an important pharmacy or pharmacokinetic value that's important is Cmax and Tmax. Cmax tells you at what time, or I'm sorry, not at what time. It tells you where the peak is with absorption of any drug, and Tmax is where the peak is highest, like how many minutes or hours passes before you get the peak concentration in your blood. Cmax and Tmax are both affected significantly by food intake. And the reason this is important for Trazodone is that if you have sleep maintenance insomnia instead of sleep onset insomnia, at least in theory, it would make more sense to eat this with a small fatty snack. When you eat it with a small fatty snack, the Tmax is delayed from 1 hour to 2 hours, and Cmax increases by 20%. So in plain English, what this means is when you eat it with food, like a fatty snack specifically, it will take longer to work and it will be a more powerful effect. So let's say you fall asleep fine, but then you wake up 4 hours later. Taking Trazodone on an empty stomach, it might do its thing within the first couple hours when you don't even have any problem sleeping. But with eating it with a fatty meal, it might delay it enough so that it really starts working when you're prone to waking up. So Trazodone is a very useful drug for insomnia. There are various studies showing its efficacy. Here's this systematic review that just came out. I'm happy to see this because last time I looked at Trazodone literature a couple years ago, it was fairly scant. But so for primary insomnia, which means that people that just can't sleep and they have no other problems, it's not due to depression or anything, one study found that 50 milligrams of trazodone administered for 30 minutes before bedtime was effective for sleep maintenance, but that it was possibly associated with motor and cognitive impairments. Another study showed that CBT plus trazodone was the most effective for management of primary insomnia. So adding cognitive behavioral therapy for insomnia plus trazodone rendered the best effects. Trazodone also has shown to improve sleep quality in daytime functioning in another study, which makes sense since daytime function is intimately linked to how well you sleep. Trazodone has been shown to decrease REM sleep slightly and increase the third phase of sleep, which is the deep sleep that's rejuvenating. Another study showed that all doses improved sleep symptoms as rated by the sleep items on the Hamilton Depression Rating Scale. So this shows that for secondary insomnia, such as sleeping problems because you're depressed, trazodone works great. And that makes sense because trazodone has antidepressant efficacy. So to wrap up, trazodone is a very cheap, safe medicine. It's very old. I see it being prescribed for sleep every day in the hospitals and medical school. People generally tolerate it well. If they don't, it's because they have a headache, they get a dry mouth or nose, or they feel dizzy. These often get better with time. Normal dose for insomnia is generally 50 to 100 milligrams. Food significantly affects when it works and how well it works. So that's trazodone. If you have any questions or comments, leave them below. And again, always talk to your doctor before making any medical decisions. None of what I have said constitutes medical advice. Thank you.